be presented by Dr. Ostrowski from Poland, focus on elderly patient and blood pressure treatment.
Sorry, this is not mine. Okay. Chairman, dear colleagues, ladies and gentlemen, good morning. This is my pleasure to present you, on behalf of the Lipid and Blood Pressure Meta-Analysis Collaboration Group, the results of the meta-analysis of 11 randomized control trials with over 40,000 patients on the effect of hypertension therapy in older adults. And I could conclude my presentation saying that it is worth to treat elderly patients with hypertension and just go back to the table, but I will tell you why we concluded that and why it is important as we think. This is my declaration of interest, and let us start from something which may seem as a dry statistical data, but I will tell you how important it is. According to the European statistical data, already in 6 years, in 2020, 1 out of 5 of all European Union citizens will be elderly. Elderly, which is 65 or older. And in 2030, even almost one out of four. So the number of elderly people is growing, and it's growing very, very rapidly. And even now, such highly populated countries, European countries as Germany, as Italy, have already the ratio of elderly people of 20%. So the problem is large, is big. And this is something which came up from the quite recently performed epidemiological study in Poland among the elderly population. Elderly, which is the persons of 65 years of age or older. And we can generally say that the hypertension is a companion of an elderly people. 3 out of 4 are hypertensive. So the problem is really, really significant. So taking into consideration that the number of elderly people is growing, the arterial hypertension is very prevalent in this population, and the fact that recommendation on how to treat arterial hypertension in elderly people is usually level C reference, which means the expert opinion, we performed this meta-analysis to investigate the effect of hypertension therapy on blood pressure, cardiovascular and mortality outcomes in elderly patients. What is also worth to mention that we analyzed the safety of blood pressure lowering, because the data on this was even more sparse than on the benefits of hypertension treatment in this population. After an extensive literature search, we included 11 trials with more than 40,000 hypertensive elderly patients randomized to receive either the antihypertensive treatment or placebo. The antihypertensive effect of use of medications used in the studies was significant both for systolic and diastolic blood pressure, respectively almost 11.5 millimeters of mercury decrease in systolic blood pressure 5 millimeters of mercury in diastolic blood pressure. And we saw the consistent results across all the pre-specified endpoints which we analyzed, starting from the death from all causes, which just could be translated into the people live longer if we see the reduction of death from all causes. Also, we observed the decrease in the death from cardiac causes. We also saw the consistently significant decrease in all cardiovascular events, which could be translated that not only people live longer, but they also live better. They have less cardiovascular events. And last but not least, everybody knows about the very special bond between arterial hypertension and strokes. And in this elderly population, we also noticed very significant risk reduction both for the fatal and non-fatal stroke. What should be also kept in mind that despite the good results and undisputable benefits of blood pressure lowering in hypertensive elderly patients, we should be cautious about some safety issues. We discovered, we extracted from the literature, and we saw that the risk increase of fall, we observed the increase of risk of falls in these patients by 21%. This was statistically significant. We also noticed statistically insignificant angina pectoris hospital admission increase and heart failure hospital admission increase, but it should be mentioned that all this information are from very limited sources. For example, the information about heart failure hospitalization admission was extracted only from one study, because only one study out of these 11 gave us this information. So in conclusion, as I mentioned at the very beginning, in conclusion, antihypertensive therapy in older adults is very effective, significantly reducing the number of cardiovascular events and mortality rate. The increased risk of falls should be a matter of further investigations, and really, it should. I think we could call for an action in this respect, just to really, maybe even perform new prospective trials in this population, because data is really, really sparse. And we will be trying to answer the second question, as the second point says, on the optimum blood pressure level in this population, because it is also a very hot discussion even now on this matter. So thank you very much for your attention.
Are there any questions? Make you one question. Do you perform any analysis of any differential effect from different drugs?
No. It was just the influence of blood pressure, just lowering, no drug specific.
It's a very frightening experience to see that 3 out of 4 in our population soon will be hypertensive above the age of 70. Yes. Does this mean we have to put the entire Swedish elderly population on drugs?
The drugs are not the first, in fact, intervention in hypertension. We also should implement all instruments which we have, which is also, of course, the lifestyle modification, if possible, dietary modification, if possible, and then drugs. So maybe in the far end, yes, who knows?
But if you have old, stiff arteries, do you think it's still any use to get our old people in Sweden to start to run around and eat like rabbits? Or?
Maybe it's too late, maybe it's not. We don't have that data.
Well, we recommend it anyhow, but we lack data on the effect of lifestyle in elderly people on hypertension. That's a problem indeed. Yeah. Any,
exactly.
Yes?
Blood pressure in elderly is decreasing with age. You have, for example, in group more than 80 years, it's lower than.
Yes, it was lower. Yes.
Why so? How would you explain this? Because atherosclerosis should be progressing.
Yes, logically speaking, exactly. There is no explanation on this, because the epidemiological study was observational one. But if I were to answer this question, these survivors are simply healthier.
Yeah, that's right. That's right.
Are simply healthier. That's why.
That's what we see. If you get an old forest worker from Sweden coming in, his blood pressure is 120/70. There are still healthy old people that have low blood pressure. It's not necessary that everybody become hypertensive.
Yep.
I just have a quick question, Marlene Vesco from theheart.org. So this includes everybody. That's kind of the older and the younger older. I guess you didn't have enough data to differentiate or between people who are in the community.
There was not enough data. It was really even it was even difficult to find this data on people because we included the studies in which the median age was 65 and higher, there are no such studies. Too little data to differentiate. I hope there will be, because the need is huge. The need is huge. 20% of European population in 2030 will be elderly, and 3/4 of them with hypertension. So the problem is really significant.